Hello, I'm Lucy Astle. I'm a GP in Burnley and I also work as the Health Inequality Clinical Lead for Burnley East Primary Care Network. In working in health inequalities in Burnley, we're part of a health and wellbeing partnership with Burnley Council. It also links in with the ICB, with the community voluntary sector. And we've been working on a project looking at how we can improve respiratory health and housing in Burnley. Because our data shows that we have high hospital admissions for respiratory conditions. And we also know there are housing challenges in Burnley as well. So actually, the course was recommended to me as a way to ensure that our project is research informed. I really enjoyed it. I expect everyone says that. The good things about the course for a busy GP, the workload was manageable. It was good that the sessions were online. They were just an hour in length. And then there was a 1 day workshop at the end, which was a good opportunity to meet people in person. I've tried doing longer courses before, um, around systematic reviews, um, and that's quite a challenge around clinical work. So I really enjoyed that it was a manageable amount of work. I even enjoyed the homework. I I liked that you were given a task to complete and plenty of time to complete it. But you didn't get in trouble if you didn't do your homework. I think it was a skill of teaching you the critical thinking and critical appraisal. As a clinician, we just get on and do things without always thinking about the evidence or thinking about particularly the economics of interventions. So the opportunity to focus on that, we all know that the NHS budget isn't unlimited. So having the opportunity to link with a team and understand how um, economic factors impact on interventions, I found really helpful. And now taking it forward, particularly with the ongoing work around health inequalities and working as a primary care network, um, and at the level as Burnley as a whole town, um, I feel like I more think about the economics of what we're doing, and the interventions that are proposed to us or the range of interventions that we might be testing. So I think the skills of critical thinking and appraisal have been really helpful. We focused on a paper that was particularly relevant to Burnley and the link between housing and health. And we looked at a paper which had focused on the economics of retrofitting or carrying out home improvements to social housing. And so retrofitting, double glazing and new boilers in social housing and looking at the economic impacts on health and well-being. And there was some evidence from the paper that we appraised, that carrying out these activities improves the health and well-being of people. So we've been able to take that learning and share it to the health and wellbeing team, so directly to Burnley Council, to Calico as the main provider of social housing in Burnley. Now there's still challenges with funding, so I'm not saying it means that we can suddenly do this work, but I think it helps the council organisations to see the benefits of linking with researchers and linking with this work to inform policy decisions. Not at this stage, but what I have noticed at Burnley Council, they're aware of this work and aware of linking with the universities. So actually at the meetings they're saying, are you able to share what you've done yet? So there's a increased awareness and interest in the work, which maybe before participating in the course, there just wasn't awareness that this work went on, or actually the benefits of linking with this work and with the universities. So there's definitely been better awareness and interest, and also enthusiasm for wanting to work with you. We have the plan to present the work back to the Health and Wellbeing Partnership. So I'm hopeful through that it may lead to policy change or just an increased awareness of the work, or actually that linking around other health topics. The problems in Burnley are not limited to respiratory and housing. So actually doing this work generates other questions that people want answers to, and maybe other people can link in with the course. That would be great. I think it does. I think you present the course in a way that is accessible to clinicians. Um, it's hard when your whole sort of job role is focused clinically. It can feel daunting to link with research or understand the terminology, or sometimes feel quite intimidated by the intelligence of researchers. But the way that you deliver the course, you're all friendly, approachable. Nothing was a silly question, but I really appreciate learning the way that you think critically. It genuinely it helps in other situations, and I always take it back to even to patient care and problems that patients bring. You know, on a very small scale, they want to understand the benefits of treatment, or even the cost effectiveness of treatment. So actually applying what you taught at a practice level or in consultations has been really helpful as well.